There's a couple rules in business. So you need to get exchanged for what you do. You need to get paid for what you actually do. Hi, this is Dr. Mike Carberry from Advanced Medical Integration. I want to talk to you about how to ensure your patients understand the value of their care. When we treat patients, a lot of times I've noticed chiropractors, they'll have a big heart and they'll want to help somebody so bad that they give away services. And that hurts your patients in the long run. I've met chiropractors that had a heart like that and went out of business and could not help their patients because they were out of business. So you need to get exchanged for what you do. You need to get paid for what you actually do. If you don't, it's going to backfire on you because the patients will not value it. Patients need to value what you're doing for them, and they need to know that value ahead of time so that they understand how much they should pay. We're not trying to get more money out of patients. What we're doing is we're offering a better service so we get paid a higher amount. We're bringing together different professionals that offer a different outcome for the patient. So the way you actually bring out the value of your care is you have to actually focus in on what is actually happening with the patient. I'll give you an example. When a patient comes in, they very rarely say to you, listen, the reason I'm here is because my buddies that I golf with won't let me golf with them anymore because I can't keep up with them. What they're going to say is, I have knee pain or I have back pain. And then they're not even going to bring up the part about the buddies not letting them golf with them anymore. So why is that important? Well, it isn't the back pain or the knee pain that brought your patient into your office. Chances are they've had that problem for a long time. Chances are they've had that problem probably not just years, but maybe even decades. And they haven't been motivated to get rid of it. But what I've noticed over the years is when a patient starts to have a door close on them, something in their life that they have to now consider giving up, that they really don't want to give up, that's what motivates them to take action to get care done. But they don't tell you that. In most offices, they just go, oh, you have knee pain, here, fill this out. And they put you in a room. A medical office will say, well, there's a back patient in room 3. There's a knee patient in room 2. That's a very impersonal way to look at it. And Americans have actually grown to expect that. But the right way to do it is to actually find out what is messing up in their life that they're seeking with care now. It's important for a couple of reasons. One, if you're going to be building an insurance company, the agreement that an insurance company usually has with that patient is to keep their activities of daily living to a certain level. It's not to help them get rid of pain. It's to help them be able to function in life and guarantee their activities. So it would be smart as a doctor for you to have staff that are trained to ask the right questions. Mr. Jones, when you have this back pain, what does it interfere with? Well, it interferes with me sitting in a golf cart, especially a golf cart, because it bounces and it hurts. Oh, really? Tell me about that. Well, I golf with my friends and I started to walk because I couldn't ride in the golf cart. And now I'm slowing their game down so they don't want me to play with them anymore. Well, how does that make you feel? Well, I feel terrible about it. It's communication back and forth where you're actually getting to the real cause of why they're there. And it also happens to be the thing you need to document to show improvement. If you're going to treat that patient, your obligation to provide information to the carrier who's going to pay for that care is, are you actually helping them get back the function that they lost because of this condition? So how do you do that? Well, you have to have case managers or people that collect information from the patient that can actually weed through a light or an unthought answer. We call it a glib answer. A glib answer is when you're having the worst day of your life and somebody walks up and says, how's it going? And you go, oh, fine. You didn't really think that through. It's really not fine. It's actually the worst day of your life. So you have to be able to cut through that. You have to have people trained to be able to ask those questions in a way that do not offend the patient, but actually gets to the real cause of the problem. And when you get to the real cause of the problem, the patient starts to look at it like, yeah, when did this actually start to happen? Did this start happening? Well, I know last year I was having trouble with it. What about the year before? No, it wasn't so bad. So it was there. Yeah, I guess it was. It just wasn't so bad. When was the first time you ever had back pain? Oh, that was decades ago. What happened decades ago? Well, nothing. I just started getting back pain. Really? Have you ever had any injuries? And you start going through this. We teach our clients to have their case managers learn how to ask these questions in a way that's actually looking to the past so the patient can actually spot the time where they messed up their back. Because if you're going to help them fix that back, and not just cover up the symptoms, but I mean actually fix the back, the one who's going to fix it is the patient, not you. You're going to assist in fixing it. You're going to figure out why they're not fixing it themselves. It might be that you have to actually get that patient aware that they have a problem at a specific level in their back, and you have to retrain that vertebrae to move properly, and then the muscles around it have to be retrained as well. And when you do all that work, all that attention the patient's putting on it, they're probably going to fix it. Some people say, well, it sounds like you're talking about a placebo effect. Well, I read an article one time about a medical doctor who was a knee surgeon, and he thought maybe what I'm doing is just a placebo effect. Because I get into that joint and I start messing around with things, maybe I get that patient to focus so much attention on the knee that they start to fix it. So what he did was he did an experiment. I think it was at Southern California Medical School. And what he did was he said, I'm going to give some patients the real knee surgery, and I'm going to give some patients the fake knee surgery. Well, when you got the real knee surgery and fake knee surgery, they got put in a hospital gown, they had to fast, they got betadine on the skin, they had to get the anesthesia, and then they went, while they were under, they had incisions put in their skin, they had sutures put in, but they didn't get the real surgery. And the ones who got the real surgery got the real surgery. And then he started comparing the results. And he found out that 74% of the people who got the fake surgery reported improvement. And then he found out that 50% of the people who got the fake surgery reported improvement greater than those who got the real surgery. It makes you wonder, who's doing the healing? Well, obviously it's the patient. The doctor's job is to stimulate that patient to heal himself. So you have to collect this data in a way that gets you, so the patient can see what is it you're actually doing. If you could help me fix this knee problem, fix this back problem, fix this neck problem without a surgery, without opioids, without cortisone and all these dangerous drugs. If you could help me do that, well, that would be really valuable. And how valuable would it be? Well, I've had it for, oh my gosh, I didn't realize it. I've had it for 3 decades. It started when I flipped my truck in college. Didn't put that together before. I realize now that what you're working on is not something that's been bothering me for the last 2 months. It's something that's been bothering me for the last 30 years. Well, when if you communicate with a patient that way, with sincere communication, and you have somebody trained to actually go for the real answers, not the glib answers, but the real answers, the patients start realizing, holy moly, this is way bigger than I thought it was. If I could fix this, well, my nervous system is being affected. That might be why I have a problem with my prostate. That might be I have a problem with my bladder. And if I fix that and that gets fixed, that'd be a win-win. So they start to realize what you're actually going to do is get granular, change all the tissue around that spine so that it stops hurting, it starts functioning in a way that it was supposed to be functioning, and they get their life back. And that is worth a lot more than what a lot of chiropractors are getting paid. In fact, if you were to look at that, most patients are going to drive up in a car that costs them between $20,000 and $30,000. There are definitely cars more expensive than that. There's definitely cars less expensive. But right now, most cars are going between 20 and 30. And yet, we're charging them a couple thousand to fix their back, which has been causing them grief for 30 years. If you can present it in the right way and they realize the value of it, we're not going to be asking for $20,000 or $30,000. But if we did, it wouldn't be outlandish. But when patients realize this, they're usually willing to pay a lot more for that service than what would typically be offered. So we teach this so you can actually have a cash component to your insurance or to your collections for whatever is not covered. When the patient says, well, my insurance doesn't cover this, we say, that's okay. We have ways to help you pay for it so you can get coverage for it. And now you're evening the playing field. You're making the insurance factor of unlevel the playing field goes away, and the patient's making a decision, I'm going to invest in this, and the outcome that I'm going to get is I get my life back and I can play golf with my friends. If you approach it that way and you train that way with your staff, which we teach you how to do that, you can actually get patients to get a lot of things fixed and go a lot further in paying for more services so they get better outcomes. And that's what it's all about anyway. So we teach this on a regular basis. We teach a lot of different ways with modules on our website, with live trainings at our training center here in Clearwater, Florida, and also weekly on our webinars that we do weekly. So if you're interested to find out more about how you can help build the value of your patients or help your patients to realize the value that you're giving them in their care, just reach out and click this button wherever it is. It's either next to me or above me or below me, and we'll connect you with our Blueprint organization or Blueprint project. We'll show you the blueprint we use to help our clients to do that. And maybe we can help you do it too.